thank you from the bottom of my heart for the invitation to come and join you in a country, in a province, in a city that has a place deep in the heart of myself and my family. So it's an enormous privilege, and even more of a privilege to be asked to kind of give the plenary to open the event. And you kind of know what it means to be the plenary speaker. You're supposed to stand up and raise energy and optimism and excitement about the future. I think that's why they hired me. I'm a little nervous about it. I'm not going to talk about your country. I'm going to talk about mine. I know that everything's fine for you guys. But the reason I'm nervous about it is the truth is that it's crap right now in my country. Forget healthcare for a minute. You know, post-pandemic, nothing kind of works the way it did pre-pandemic. The trains don't work properly. Half the people are on strike. Do you know why that is? It's because people are fed up with being poorer. And why are we poorer? Because we kind of did an act of kind of national economic suicide in Brexit, and are now kind of learning what the lesson of that is. People are angrier. They're more fraught. That kind of coming together during COVID evaporated so quickly. And now you see people more polarized than ever. They don't know what the solutions are. Politicians are anxious about where they go forward. We face an election in 18 months' time in which kind of neither side really know what to do for the future. And then Her Majesty the Queen died, and the King, the guy had waited 74 years, 74-year job interview. And then he just looked so, didn't you think he looked so uncomfortable? You got the job. Perk up. It's crappy. So it's quite hard, isn't it, to raise energy and be optimistic. But optimism is a fundamental characteristic of leadership. If you can't be optimistic, give up being a leader. I'm speaking to a room of leaders now. But in the face of all the things I've just said, if all you are is kind of talking about how great it's going to be, in the reality of people's lives, grounded in the difficulty of their day-to-day lives, you just look completely disconnected as a leader. You lack basic credibility. People switch off. And this is a real current challenge. Oh, we're too far ahead there. Can we go back? Thank you. This is a real challenge for all of us as leaders. You walk lots of tightropes as leaders between opposing kind of issues that you have to manage. Should you be tougher on people or kind of give them more space? Should you go faster? Should you go slower? And right now, walking this tightrope as leaders of should we be optimistic and bright-eyed and enthusiastic about the future or grounded in the reality and difficulty of people's lives is a really tough tightrope to walk. It happened to me just a couple of weeks ago. I gave a session to my group of kind of 200 people who lead my emergency care services across the country. And I thought it went great. But I got some feedback afterwards, which was the team were hoping for a little bit more hope from me. I kind of just walked that slightly wrong side of the tightrope because I wanted to ground what I was saying in the reality of people's lives day to day, trying to make things happen in a system that wasn't working. So I have a solution for that today, which because of the technology you've already seen, which is that I'm going to do a section about how hard it is. That's the downbeat section. Then I'm going to transition into why, having grounded us in the reality of what we face every day, in why I believe there is room for optimism. But more importantly, I'm just going to share what I'm actually trying to do and what I think the things as leaders we can do. It's all very well to talk about the possible futures, but you have to do things to try and make them happen. And I'm going to talk about that. So let's do the miserable part, because we need to be grounded in where we are and take you back, as the minister did, to March 2020. I live in the city of York. I was walking to the station. As you walk to the station, you look to your left, you pass this sign. And you know, 2020, March 2020 was when we were seeing the pictures coming out of China and Italy of patients in real distress and systems beginning to collapse, and we knew this wasn't a drill. Something big and bad was happening. And I did look at that sign on that day, and you know, we all thought that mass deaths for infectious disease were a thing that happened 200 years ago, right? And all of a sudden, it was back with us. And the reason I was getting on train was the day before we'd had a call for myself and the other 4 people who lead the big kind of privately owned healthcare companies in the UK to meet with Sir Simon Stevens, who was the chief exec of the NHS, urgently the next day. And he showed us the graphs of the projections of what COVID was going to do to the country and healthcare systems. Those graphs had critical care being overwhelmed within 10 weeks. It was a moment, a real moment. And he asked for all the capacity of the private hospitals and all the other hospitals to help. And of course we said yes. We gave all our capacity from that day. And I had to go back to the office, and you can see I had some follow-up calls to explain to people that everything we were doing was just changed. And we were about to put every effort we had into managing a pandemic. And the point I'm making is this, which is that this was a global event. But we all have a story like that. As I'm speaking, you will remember the moment that it converted from you, from something that was happening somewhere else, to something that was going to affect you and your workmates and your family in a very deep and profound way. It was global and deeply personal. And then remember how it kind of played out. You know, that first traumatic wave, the bottom is critical care admissions, the top is infections. We weren't even counting infections then. We didn't know how many people were infected. We just lived through this onslaught of emergency care. We got through because something weird happened that we didn't expect, which is that all the non-COVID emergency patients disappeared. A strange thing that I think we still don't understand, and I'll say some more about patient behavior. And then we thought it was kind of, we'd beaten it. And then the second wave came roaring back, harder and deeper. And people realized this wasn't a one-shot thing. We were going to have to face this again, and probably more than twice. And at the same time, the scientific miracle of vaccination was beginning to take effect. I got COVID at that time. I have quite a serious underlying condition. I came within 20 minutes of ringing for an emergency admission because my breathing was going, and I just managed to stabilize. But also during that period, I lost my first close family friend and my first close work colleague. The shit got real for all of us. And then that period since then, where we've been living through this fantastically vaccine mitigated, but still kind of relentless waves of pressure that meant we've never really been able to get our systems back online. It's been a tough, tough global and personal experience. But of course, when it became clear that as pandemics have in the past, it was beginning to lose potency, and as the amazing impact of vaccination began to tell, we all had a natural reaction, which was we wanted to declare it over. Done. Let's get back to normal. It's completely understandable, right? As people have heard me speak before, I'm always happy to reflect on my extraordinary ability after all these years being a leader to continue to think and do dumb things. Amongst the dumbest things I've ever done is I decided that that was great, it was over, we'd just switch all our facilities back on and start working again the way we had pre-pandemic. It just didn't work. Back to normal is, I'm afraid, an illusion. And it's an illusion because some things changed really profoundly and maybe permanently during that pandemic. It had some really deep, profound demographic, societal, workforce implications. There are reasons why we can't go back. The first is that for those in healthcare, it created an enormous, terrifying backlog of work in a system, public system, I guess like yours, that was sized to just about cope with the demand each year. In fact, we were just a little bit short of it each year, but it certainly couldn't cope with a huge backlog of demand. That's the number of people waiting for routine surgical opinions or procedures. The period when I was in charge of the country was the period it was good, on the left, right? 10 hard years of my life and thousands of other colleagues to achieve that. 10 hard years. It drifted a bit after that, but then you can see the pandemic just blew a hole through it. That figure is really interesting, 7 million people waiting for treatment. The estimate is that that should be 3 million. About 3 million people still who would normally have presented for an opinion at this time just haven't appeared. If those people appear, we've got even more of a problem. But you can see that's a transformational change in what you're trying to achieve. And by the way, our hospitals are full. The bed occupancy on that graph is back to where it was. It's not like we've got loads of spare capacity because we sized our system to be just about be able to cope with what was coming each year. Really critically, people made different decisions about their lives and their working lives after the pandemic. Hundreds of thousands of people left the workforce. In the UK, and those that are left are tired or worse. In the UK, Brexit, a national idiocy, about 250,000 people left the workforce. Twice as many as the Brexit problem have left the workforce because of other issues, particularly health. It's a really interesting statistic. Lots of people in their kind of 50s and 60s, that's where it happened, maybe with underlying health conditions, didn't come back after Brexit. They decided to run their lives differently. It's not just the numbers. What do we lose when we lose the 50 and 60-year-olds? We lose experience, deep experience. Younger people, fantastic, full of energy, commitment, smart ideas. But any sports team needs a blend of youth and experience, right? And we've hemorrhaged experience. It's a real difficult, deep problem. I'll skip that one. And I said the ones that are left aren't feeling great. These figures, you could look at them, they're terrifying. How our people report how they feel about work. Half of people, frontline paramedics on ambulances, saying they're burnt out. Between a third and a half of nurses and doctors. Does that sound safe to you? Does it sound a good place to start building the future we want? It's scary. Am I doing a good job in lowering energy at this point? Gets better. And like I say, patients have changed their behavior. This is a bit of a technical graph about people who need help with less serious responses from an ambulance. And the reason those graphs are haywire is that people are just not asking for help at the same times in the same patterns as they were before. It's all kind of subtly changed. As they can't get access to their primary care doctor, they go hunting for access in different routes at different times. It's all very peculiar and hasn't settled down to a new level. So things that we don't understand about the way our patients feel they want to interact with service have also changed, and we haven't caught up. So look, every time as leaders we think, okay, this thing's done, let's go back to where we were. You've just got to let it go. Back has gone. It's not available to us. Things have changed, some of them permanently. They're all profound. And there is no normal to go back to. There's a new environment that we have to reframe our leadership in. The habits of talking about going back are really deep, by the way. This came out last week. The tragedy for me is I've been doing some advice to government, and this is a report that I actually helped contribute to, and then they published it with a title, A Recovery Plan, as though we're recovering back to something. It's gone. There is no back. Anyway, thank you for sticking with that. Based on the feedback from my team, I now want to talk to you about going forward. So the first thing about going back, not going back, is why would you want to go back anyway? I don't remember some kind of land of milk and honey where everything was perfect and we thought all problems were fixed. You were bitching about it then. It's why we have the amazing work, Devon and Christina and the team and all of you guys on quality, because we were dissatisfied before, right? We don't want to go back to there. We didn't like that normal. And actually, one of the reasons we didn't like it is very critical with this, which is that we had quite deep medium-term challenges about demographics particularly, a growing number of people we had to care for, a capped budget, and a restricted number of people in the workforce that were gradually, year on year, tightening the screw of what we were doing. You were feeling it, just year on year tightening a bit. But it was the kind of classic boiling a frog analogy, right? Because it was happening gradually, we kind of lived with it. One of the weird things about COVID, in my opinion, is amongst the kind of really interesting effects that this virus had, is it's acted a bit like a time machine. It's fast-forwarded us between 10 and 15 years in terms of those pressures. The pressures that we knew were coming in terms of access to people, to care, and the impact on people have all been brought forward in a couple of years. They're with us now. And I think, for all its problems, that's a good thing, because we can't put them off. Let's leave this for the next year, or the next 5 years, or the next political cycle. They're real today. We'll start dealing with them today. There are also, and the Minister mentioned this, a whole series of things that were kind of in the too hard box, which we just switched on in COVID. I'll talk a lot towards the end of this about purpose. But, you know, when I think about the toolkit for improvement, I always start it, those of you who've heard me talk about it, with talking about purpose. There was such a deep, shared, profound purpose in helping our country and citizens through what we knew was a real existential threat. But all the other problems evaporated. I remember a chief executive of a large trust ringing me up in exasperation to say, all the things I've been trying to get those swines to do for 5 years, they've just done in a day. You must have had that experience dozens of times, right? The Minister said this, right? It showed that when we cared about it, we could do it. I think it's a little harder in practice. I'll talk about what you actually have to do. Because actually that sense of purpose has kind of converted a bit to a slight negative right now. But it can be done. And some of the things we do, again, the Minister mentioned them, things like remote consultation, things that people said would never happen, just happened. There are things that happened that we can hold on to and build some more things from. And for your country, your province, like my country, having a universal healthcare system, as best we can provide it, is a fundamental keystone of the kind of what it means to be citizens, that we care for our people in a universal way. And we knew, because of those demographics, it was gradually being unraveled. The fact that it's come to a crisis is hard, it's difficult, it's wearing, it's anxiety-making, but it brings us face to face with the fact that if we want it, we better take some action now. It's a motivator to do the things we need to do. All that is meaningless unless you have some things you can do as leaders. Just talking about we should hold on to the things that were great, we should make it better, we should reconnect with that purpose. It's all meaningless unless you actually have to have a game plan for as leaders of what you are going to do to make that a reality. First thing I want to say is that most of the game plan is what it was. The work that you've done and the capability that you've built on quality improvement is still a foundation for what we need to do. We don't need to throw that away and start a whole new kind of load of different kinds of activity. The things that you've learned to do to make change happen are still the cornerstone of the skill set that you need for the next period. But goodness me, the context has changed. It's a really different world that you're implementing those things in. And I've had to reflect really hard on how I need to change my leadership practice and my focus and the way I work with my colleagues across the organization in the wider systems to make sure that that work has some chance of success in this transformed, difficult context that we find ourselves in. And I'm focusing on 4 things. I'm going to say something about each of these in a minute. The first one is energy. The second one is people. There are clues that healthcare is a people business. And I'll talk a bit about not people as well, which I'll leave you to guess about. Talk to you about time. How fast can you go? It's a real current challenge. Both of our systems, we live in a political environment where there are elections and external timescales. And at the other side of that, reality about what you can achieve in what time. And thinking about what is the fastest pace that's realistically possible is a real challenge. And something about reinforcing that point about it's basically the same tool set, but maybe with some modifications. For me, right now, the most important thing I think I'm doing is trying to make sure that energy goes up amongst people. Because energy isn't in a great place. If anything, I think many colleagues I meet in healthcare in the UK are in a negative energy spiral. They're tired. They're being asked to do more to get things back. By the way, it's very hard to get energy to go back. It's the wrong framing, but that's what they're being asked to do. Those things are not working that well. Patients are unhappy, colleagues are unhappy, people leave, the situation gets worse, people are asked to try even harder. It's a negative energy spiral. One of our fundamental jobs as leaders has to be to intervene in that negative spiral and try and get it to a more positive place. Nothing else that we try to do will work unless we get people feeling positive about their engagement with change. People sometimes say to me, oh, we're burnt out because we're so busy. Well, it's true. It's obviously true that people are incredibly busy. But I don't think it's necessarily right that people get burnt out because they're busy. Even when they're really busy, people can be massively energized when they're busy. The question is, busy doing what? Stuff that makes you feel great, energizes you, makes you feel positive about the future, or stuff that just grinds you down? And I think the problem is not so much that people are too busy, although they are very busy, but because underneath that, they're unhappy, they're anxious, they feel overwhelmed. They don't feel safe psychologically. One of your jobs as a leader is to take the responsibility for safety and say, that's me. I'm the person who needs to make sure that we're there and stand up in court if there's a problem. You let me know what the best we can do is that I need you to do, and then I'll stand behind you. I have your back. You might want to recognize that people are busy, and if you can do it in the way HR works for you guys, maybe cut people some slack. We've done a little bit of it formally through giving people another couple of days holiday time during this year, and we're doing quite a lot informally and just being a little bit more kind of relaxed about people's time at work. It sounds counterintuitive when we're so busy, but what we have found is that the more slack you cut, I guess within reason, the more contribution people make. The fact that they've got an escape hatch if they need it means they don't have to use it as often, right? They feel a little safer. So we have cut people a little slack, but mainly we're just trying to make work more enjoyable by trying to identify those things that we can do, even in this tricky environment, and just be enormously positive about doing it. And when we reach small goals, celebrating and maybe even over-celebrating their achievement. I want to use an example that's not about my organisation. It's about another kind of bog-standard organisation inside the NHS in the industrial northwest of the country. And everybody, because of that graph I showed you about people's treatment being delayed, is trying to do extra work, see more patients, put more patients through the operating room. Well, look, I guess there are two ways of doing that. One is to say to people, you just got to do more work in the next month. We're going to put more patients on, work harder. That's the negative spiral way. What this organisation in Bury did, and they did it alongside a number of other organisations in the UK, was try and turn that into a positively energising experience. They had an energising brand name for it, Super Saturdays. Not can we get you to do a shift on Saturday, how much will it cost? But we're going to do Super Saturdays where everything's going to be fantastic. We're going to make sure that everything runs perfectly. We're going to get more patients through. We're going to get loads of satisfaction from it. And they did it, and exactly the same work that was going on in neighbouring trusts and was flattening energy out, created energy, excitement. People wanted to do it more. They asked when the next Saturdays they could do were. They felt good about it. Staff in healthcare fundamentally like to do their work for patients. Number 3, on raising energy is, as leaders, you've got to be present. Now, that's a picture of pretty much the back of my shoes. For those of you who are orthopedic surgeons or podiatrists in the room, I don't want to hear the comments about my gait, which I know is a problem. But you get the point I'm making, right? Which is one of the things that you're going to have to spend a lot of is shoe leather. Being there with people in the moment, talking to them all the time, formally, informally, listening, responding, connecting with people, understanding, rehearsing back to them the things that we might do together to make a difference. People are anxious, unhappy, worried about the future. They do look to you as their leaders about where are we going, is it going to work, how do I feel about it, give me some hope, hear what I'm saying that's making me anxious. You can do it, it takes a lot of your time and energy, and you need to watch your own reserves. And sometimes you do it and you wonder what difference it makes. But trust me, people need their leaders not to be 100 miles behind the front line, safe in a manor house directing the troops. They need to know that you're there. Listening, be a real understanding. It's costly of your time, but not as costly as not doing it. And lastly, don't be frightened of fun. It was mentioned earlier, which was great, right? I mean, you're allowed to have a nice time at work. COVID was a really kind of serious, intense kind of period. And actually, I think over the last 30 years of my career, quite a lot of fun has gone out of healthcare in some ways. But put some back in. Again, talking about things that I did. I'm not sure this was a mistake. I probably would do the same thing again. But one of the things I reflect on was I wrote an email which has gone down in the history of the organization as the so-called bucket of sick email that I wrote. So as we thought we were coming to the end, we'd got through the first two waves and things were going to be better. We wanted to raise energy. Christmas was coming up. We put a reasonable amount of money in the pot and made sure that everybody was going to get a great party that Christmas. Let their hair down, have fun. I had a simple rule, which was don't get arrested. Okay, it was anything apart from that I was okay with. And then I think I get lost in the waves. Was it Omicron hit that kind of, was that Omicron? And all of a sudden that December it started ramping up. And it was clear to me that having mass parties for hundreds of our staff mixing together was madness. And I cancelled them. I wrote this email, you don't have to read it. It was the right thing to do. But the mood and the energy and the optimism in the organization dropped like a stone. People so wanted to have something nice, enjoyable, fun. Now, we did the obvious thing and made sure they had spring parties that were great, and in some cases, borderline being arrested. But it was great. You should be investing in fun. Sounds a bit kind of trite, but I really mean it. You've got to make people feel happier, have a smile on their face more often. It's a leadership job. Second, that was the first thing I'm focused on, the most important thing right now, raise energy. Second thing, people. There's a war going on for staff. Did you have the Great Resignation here, where everybody just left their jobs? Kind of weird. Do you use the phrase recruitment and retention? Is that a phrase? Great. So a great phrase about how you get people. It's the wrong way round. Retention is much more important than recruitment. You've got to really try to find out why people are going and do something about the specific reasons why they're leaving. They're so precious to you that every time they leave, it's a problem. And when we ask people, they tell us a thing that's salutary about running the organization, although there's a general truth, which is that in general, people don't leave organizations, they leave their bosses. Culture of my organization, I mean, I like to think, a strategic leader and setting the culture. The reality is that the culture of my organization is set by about 300 people who all run teams of between 30 and 100 people. That's really what sets the culture. How does that work? And those people, that team that drive the work of that, of those 30, 50, 100 people around them are fundamental. And so we've invested really heavily in developing those people because they felt really squeezed about this problem, really anxious about what to do. We've got him up there telling me to make it better. We've got staff telling me it's really difficult. They are deserving of enormous support and development to get this right. Some of you, I guess, in the room are those people, right? And you need support to do that work well. One of the things that happened in the UK in COVID was that people came back to work, but they didn't want to work in the same way. Those people who'd worked flexibly and remotely didn't want to go back and work in the office. Even clinical staff who'd worked kind of through the COVID in a much more direct way wanted a different deal in terms of the work they did. They wanted flexibility and control. They wanted different work-life balance. It's really scary when staff are short to take a process, say, of deciding how you're going to fill shifts over the next month. And because staff are short, you want to control that process. You want to direct it. And actually say, no, you have to flip that on its head, use all the kind of apps and tools that now exist and say to staff, you choose your shifts. Look, we'll have conversations if we've got real mismatches. Turns out that, that the amount of holes you have to fill, for us, is less than the centralized process. People do deals amongst themselves, they figure out how to do cover, they take the time they want, they don't do it through bureaucracy, they make it work. Less control has actually given us more control over what we need to do. Be brave. Let staff decide how they want to work. They'll surprise you when you give them that control. Maybe they won't surprise you, but they will show enormous commitment to their jobs in the way they do it. And lastly, I talked about the older people my age who are leaving the workforce and how precious they are and how we need to hang on to those and make sure they feel supported. But we also need to recognize that, and these are very big generalizations, but younger people have a very different view of kind of what work is and how it works for them and what matters. You know, if I'm not doing real things on the climate emergency, if I'm just ticking the box on that, young people have no faith in the organization. That's the truth of it. They don't believe it's a place they want to work because these people are boomers. So you've got to create an organization that's not paying lip service but is real about those things. And lastly, healthcare professionals want to do the job they want to do. Some of the saddest exit interviews that I read from people who were leaving when we were trying to understand were people who said, I came because I wanted to do hip replacements for people. I didn't come because I wanted to tell people the hip replacement was cancelled 5 times a week. You need to give people the ability to do their job, not some other terrible job. And I said people are not people. Even after you've done all that, there is still a shortage, global shortage in some of the key people. And you need to figure out ways of using technology really aggressively where you can replace people to do it. People get anxious about it. I understand that. They're right to be anxious. There are still things, even in this world of AI, annihilating us within 5 years. There are still things that only humans can do, and we need to focus people on that. Interestingly, when you do it well, it's great, but you take out the easy work from people because the technology replaces the easy work. So maybe that patient that had a 15-minute appointment, but you knew they were going to be easy, you don't have to see anymore because the technology has sorted that patient out. And what that means is that your shift now consists of all the difficult patients, and you need to be conscious of that and recognize it in the working pattern of those colleagues. And as a result, we've done a good job in reducing our vacancies just by focusing on those things. Time. I met the minister for 5 minutes. I don't know him. I've worked with lots of ministers. Look, they're under political pressure. They want things done quickly now. So do our patients and communities. But what is the fastest time you can do things? That graph on surgical waiting time, well, it's got a shape, isn't it? It's the shape of a mountain. You can't sprint up a mountain. To use another analogy, the fastest speed you can run a marathon is not your fastest running speed. It's your fastest marathon running speed. It's a different speed. You can see in the past that the way we've often managed performance is we've kind of drifted a bit, done a sprint, drifted a bit, done a sprint. That's not where we are. We have mountains to climb, and we need a pacing and a structure with camps and intermediate destinations that's suitable for climbing mountains. For that, you need data, good data, but also judgment. Those overseeing systems, people like the minister, they want success quickly. They want to move you quickly. Those of us inside systems are sometimes too cautious about how fast things can be done. There isn't a single answer in this. You have to use judgment. Those people just back-solve that we need to achieve this by the election date, so let's write a whole series of plans that do it. That's guaranteed to fail, in case you were wondering. Because you're trying to achieve improvement and confidence energy, not just grind people into the dust. And you need to choose the right targets. One of the weird things that's happening now is we've chosen in the UK not my decision, to kind of try and get off the longest people waiting on waiting lists. So loads of energy is going into there. It's a relatively small number with long waiting times. And meanwhile, more and more people are building up with relatively long waits behind. It's absolutely unavoidable. That's going to end up being a dumb decision. Choose the right targets. And then the fourth thing I'm doing is just slight reshaping of the tools. You've all got your own kind of approach to improvement. People who've heard me speak before know this is the one I use. By the way, turns out we were right that when we were thinking about improvement 15 years ago, putting purpose right at the center was fundamentally correct. People's main problem at the moment is that they had deep purpose in COVID, and now they're not sure what it means for them professionally and personally. It's all very well saying, hold on to that energy because it worked for us. The problem is the motivation has got much more cloudy. But I would add to it, as I've already mentioned, technology. Healthcare people are generally pretty poor at thinking about how technology will drive change. All the other industries in the world who are facing the problem of how they deliver better services with demographically fewer people available to deliver it are using technology to do it. We are still, at our best, enthusiastic amateurs, and at our worst, a long way out there. At our worst, technology in the healthcare business industry consists of, I choose my words deliberately, computerizing the current processes and spending hundreds of millions of pounds doing that. It's fundamentally the wrong process. So look, as I approach the end of my time, just some last things to kind of say how important I think this is and how amazing it could be for us. It was really interesting to me reflecting on kind of COVID and how it hit older people in their 70s and so on, really hard. We're just about to celebrate the 75th birthday of the NHS in the UK. It's right in the demographic of the things that were killed off by COVID. Could be COVID's biggest victim, right? There's more questioning in the UK right now about whether a universal healthcare system is the right thing to have for a country than there's ever been in my lifetime. And yet it's fundamentally important, as it is for you. We mustn't let let the NHS or any universal healthcare system be the last and most powerful victim of COVID. And it creates this deep opportunity. You know, you are the generation of leaders, and the Minister was right, again, to thank you for it, who sustained your province, your country, through this extraordinary global challenge. You're right to be congratulated for that. But in case you're doubting it at all, it turns out that was the lesser of the two challenges. And this period about creating our new healthcare systems post-COVID is more profound and more important than that period was. So don't be remembered, at least not just as the people who got through COVID. Our shared task as a generation of leaders, and many of you younger than me will carry it forward more than I do, is to be remembered as the generation of leaders who built the new version of your universal healthcare system going forward. Yes, there are things to hold on to from the past, things that are precious and you need to treasure it, but also recognizing that you're going to be forced quickly to redesign it. Because if you don't, it's going to come apart at the seams. Maybe it already is now. Parts of it are in the UK. You're the first generation of leaders since those amazing people who founded our universal systems with a task of that importance. Turns out for all the work I thought I was doing in the first 25 years of my career, which felt really important at the time, turns out I was just minding the shop. You've got to be the generation that build the new shop. It's really important. Take everything you've learned from your previous quality work. It was all training for now, and apply it to this challenge. And add those new skills around IT. And think about people and their energy as you go through that every day. Smart plans that don't raise energy and aren't rooted in people doing the work will fail. And there are people who thought that our generation would have no big tasks to do, that we were just a generation that was going to mind the shop. And it's not true. You carry a deep, exciting, amazingly challenging and fundamentally important task of creating the new universal healthcare systems for the people in the UK, for the people in British Columbia. It's our job. Let's rise to it and do it. Thanks very much.